So good afternoon, everybody. This is Angela Norris, Senior Vice President at Stonegate Senior Living. We are here today to talk about the mandate recently issued by the Biden administration in regards to an emergency regulation requirement for the COVID-19 vaccination. This mandate that was issued on November 4th will affect approximately 76,000 providers, being physicians, medical assistants, nurse practitioners, and 17 million healthcare workers across the United States, including our own healthcare workers in our Stonegate supported facility. The first dose of the vaccine will be mandated by December 6th of 2020, and the second dose will be mandated by January 4th of 2022. Every facility that accepts payment from Medicare and/or Medicaid will be impacted by this regulation. Today, we're talking to Dr. Neeraj Sharma, who is one of our medical directors at Garnet Hill, located in Wiley, Texas. This particular facility has had tremendous success in getting the vaccination for their employees. And so we're interested today to talk about Dr. Sharma and why the COVID vaccine is so important for all healthcare workers to receive.
COVID vaccines work. We've proven this scientifically, we've proven this by experience over the past nearly 2 years, that since COVID vaccines were developed, tested, and then since almost a year implemented. Hundreds of millions of people, if not a couple of billion people worldwide have been vaccinated. And it's really helped to reduce the burden of illness in our communities and our society. COVID vaccines reduce the chance of becoming ill from COVID. Now, while a COVID vaccine cannot prevent a particle of coronavirus coming into a person and quote unquote infecting them, it can prevent them from getting sick. And it can prevent the worst side effect of all from COVID, which is death. We do have natural immunity. The problem is we don't know how much. The analogy I would give you is this. If I give you a pill of Tylenol, 500 milligrams, I know how much Tylenol I gave you. If I took that Tylenol, crushed it up, and threw it onto your food, you might have gotten 500 milligrams, you might have gotten 5 milligrams, you might have gotten none of it. In other words, I don't know how much benefit you've had. As more and more data is coming out, we're learning that patients who've had COVID before can have varying degrees of immunity. That can vary depending on the severity of the infection they had, the severity of the symptoms they had, and a lot of other factors that are not under their control. But when I give you a COVID vaccine, I know how much vaccine I've given you. I know how much, within a range, how much immunity I've generated. So it's a standardized dose. So think about it like you think about when you take Tylenol for a headache. Would you rather take a pill or or crush it up and put some of it in a drink and think, maybe I got some, maybe I didn't? Think about it like when you drive a car. When you get in the car, I hope you put your seatbelts on. Now, putting your seatbelt on, of course, does not prevent you from getting in a car accident, but it helps you from getting thrown out of the car and getting hurt. But because you have seatbelts, doesn't mean you turn off your airbags. Because you have seatbelts and airbags doesn't mean you put on a blindfold and drive. We have to do all of the things that help protect us. If masks were purely sufficient to stop the spread of COVID, it would have already happened, because back in 2020, all we were doing was wearing masks everywhere we went, and it didn't stop it. Vaccines were the thing that we were hoping for, that we were praying for. We got it. Now it's up to us to use it. It's always a good thing to take vitamins. It's always a good thing to make sure you're having a balanced diet. But no rigorous scientific studies have shown that vitamin C, vitamin D, zinc, hydroxychloroquine, ivermectin, any of those are effective in either preventing or treating COVID. There are a lot of people who claim they are, but when you look with scrutiny at the information, it doesn't stand up. If it were, we'd have given it to every patient that we had lost over the past 2 years to COVID. We would rather have done that than lose a single patient, but we couldn't. When it comes to COVID vaccines, there's almost no lack of misinformation out there. So let's go through a couple of the big ones. Number one, can COVID vaccines give you COVID? The answer is no. These vaccines are not live virus vaccines. They cannot cause you to shed virus, they cannot cause you to spread virus, and you cannot spread the vaccine components to another person. COVID vaccines do not affect fertility. There is no data to show that for either male or female fertility, COVID vaccines have an impact. However, we have seen a lot of evidence to show that COVID infection, particularly in pregnant women, can be very dangerous to not only the mother but the baby. We've seen a spike in late-term pregnancy loss, not from COVID vaccination, but from COVID infection. The American College of Obstetrics and Gynecology has unequivocally recommended that every pregnant woman or every woman intending to be pregnant should get vaccinated against COVID. Now, when you think about that, you would think that their partners with whom they want to have that baby should also get vaccinated, because otherwise they're a risk to not only the mom, but the baby. Absolutely not. The COVID vaccine first started to be developed in February of 2020. That's almost 2 years ago. The first testing happened very quickly, but went through all of the stages that any pharmaceutical product has to go through in our country. It's been vetted in countries across the world, some who have much stricter regulatory regimes than ours. They've been found to be safe and effective worldwide. They're under a lot of scrutiny about side effects or any other issues constantly, and any problems have been dealt with very quickly and resolved very quickly. What would be experimental would be taking medications like ivermectin or hydroxychloroquine or vitamins or minerals with the hope that these medicines that are not even designed to treat viruses would somehow magically treat this virus. It would be experimental to take measures that are not shown to work and expect them to work, whereas we know that COVID vaccination works to prevent illness. No, because you haven't received a virus. Unlike vaccines of old, which might use inactivated viruses or live viruses, this is nothing of the sort. The two main vaccinations that we use in this country, the Moderna and the Pfizer, are what are called mRNA vaccines. That's messenger RNA, not DNA, RNA. Simply what it is, it's a letter to your body saying, make this piece of the spike protein, not even the entire spike protein, make a part of the spike protein that COVID otherwise presents to your body. When it does that, it's saying, okay, now that you've got the small piece of the spike protein, make antibodies to that. Now you're prepared for when COVID shows up. Then the mRNA is gone. It's like flash paper that a magician uses, it's gone. And the spike protein eventually also fades away as well. All you're left with are the antibodies. So you have the immunity without ever having had the infection. It's a great question. First of all, over time, you still have a lot of virus pressure in the community. What does that mean? That means that people are still spreading the virus because we have less than 70% of our population vaccinated. The virus is still spreading. We've gone back to normal. We've dispensed with our masks. We've dispensed with social distancing. We're back in school. We're back at work. And as a result, people are interacting more. So there's more spread of the virus. If we were able to have everyone vaccinated much earlier, more aggressively, I think we would have seen a lot better outcomes and we wouldn't need to worry about it right now. Additionally, one of the things to consider is that a large part of our population have other comorbidities. We have a large population of people in our country who are obese, who have diabetes, high blood pressure, who are older, have other medical illnesses. Those impact the overall immune system's strength and being able to fight any infection, much less COVID. So I'm an internal medicine physician. What that means is I treat adults. All my patients are adults, and you have the right to decide what to do with your health. At the end of the day, it's your health. I care that you do well. It's what I do. I'm a physician. But at the end of the day, if you take the vaccine and are protected and don't get sick, I'll never know about it. If you don't take the vaccine and get sick, and God forbid something bad happens, I'll still never know about it. But I hope you make the right decision, because it's not just about you. It's about all the people that depend on you, all the people that you depend on, and whose lives you impact. There's a lot more than you think. So think about that when you're trying not to get paralyzed by the fear of this vaccine. It's okay to be nervous. It's okay to be upset. It's okay to be maybe a little angry that someone's telling you what to do. We often feel put upon these days. It's okay to feel that way, but it's not okay to be paralyzed by your fears. You shouldn't be controlled by them. You should be controlled by your decisions that you make based on good information. If you have questions, ask. You'll be surprised. I've done talks like this for months now, and almost every time I do one, I'll get a new question I haven't been asked before. So ask those questions. Ask your medical directors in your facilities, ask your own physicians, ask a healthcare professional. What I wouldn't recommend you do is to go on social media and ask them. You wouldn't do that for anything else important in your life. Why would you do it for this? Please get it. The science has showed us very convincingly over the past several years that if we can have staff in facilities vaccinated to about 65 to 75% of staff minimum for flu vaccination, we can actually reduce the number of patients who die from flu. So think about it. Your flu shot saves a life. Not just yours, but somebody else's. They work. It's easy. There's no reason you can't get flu shots and COVID shots together. You can do that. I had my flu shot here and my COVID booster here. I had 2 sore arms for a day, and I was fine after that. There's also no rule that says you can't get the flu and COVID at the same time, so keep that in mind.